am going to present an atypical and unusual case of bilateral optic neuritis which happened and which was precipitated after strabismus surgery under general anesthesia. We all know squint surgery is common procedure and with high success rate, but rare complications like hemorrhage infections, tear rupture, slip muscle, lost muscle, and anterior segment ischemia syndrome. But in literature, very few neuro-ophthalmological complications have been reported, and one is that NION, which is reported after various other surgery as well, like cataract surgery, buccal surgery, pars plana vitrectomy, LASIK and all. And there is only one NION reported after squint surgery under general anesthesia. In this report, we are presenting a rare case incidence of bilateral optic neuritis which was precipitated just immediately, one day, first post-op day after doing surgery under general anesthesia in a 15-year-old female. A 15-year-old girl having accommodative esotropia with B-pattern bilateral IO overaction was planned for squint surgery under GA. This is the preoperative 9-gauge photograph with showing a significant extorsion and fundus photographs. And best corrected visual acuity was 6 parts with refractive correction, and she was orthophoric as far as esotropia was concerned with refractive correction, but the surgery was done for bilateral IO erection and significant V pattern. That's why we did bilateral IO dissection under general anesthesia using agent propofol 60 mg, atracurium 30 and fentanyl 70 microgram. And patient was, all surgical event was uneventful. On the very first post-op day, patient developed acute onset of headache, vomiting and so many things, but we thought it was the withdrawal effect of general anesthesia and supportive treatment was given. But after 7th day, she again developed with severe headache and which was in bitemporal region, and she was experiencing blurring of vision as well. And otherwise there was no associated symptoms. The visual acuity was dropped and their pupillary reaction was, right eye was brisk but left eye RAPD was noted, contrast sensitivity was reduced, color vision was normal. And we witnessed the blurring of disc margin, which was not present preoperatively, bilateral blurring of disc margin, and patient otherwise all neurological parameters were fine. And then we sent for pediatric neurology opinion and CSF analysis, all autoimmune investigations were done, we came to be normal. VEP was abnormal and increased latency bilateral, left more than right, and contrast enhanced MRI is highly suggestive of bilateral optic neuritis. And contrast enhanced MRI spine was normal, ruling out other demyelinating disorders. Then patient was given IVMP pulse therapy for 3 days and followed by oral prednisolone 40 mg OTN, which was tapered off over next 8 weeks. The second problem arise after giving steroid. Patient developed a steroid-induced glaucoma, and the IOP was after 2 weeks of therapy, IOP was 28 and 35, which was managed medically. Cup disc ratio was also increased. Here we can say the cup disc ratio increased as compared to preoperative fundus photograph. And she was kept on follow-up. Steroids was tapered over the anti-glaucoma agents with the undercover. Later on, everything was withdrawn. After 36 months of follow-up, she is maintaining orthophoria, no history of any recurrence of optic neuritis, and she is doing well. The only thing is NION is reported after strabismus surgery. This is the rarest of rare. There is no report we have witnessed having incidence of bilateral optic neuritis after general anesthesia. As bilateral optic neuritis was idiopathic, but as patient just immediately after the GA incident she developed, we investigated everything and we could not find direct association between the squint surgery otherwise, because a squint surgery was uneventful. Then we searched for a literature which we found that there is potential link is reported between females between 30 to 39 years of age group developing optic neuropathy with having given propofol as an anesthetic agent. However, trial did not provide has not provided the details and duration of the propofol. It is available on Google, and we cannot conclude that only single incidence of this can be directly linked to the GA agents, but this kind of incidence can be kept in mind because number of times we see squint surgery ke baad these things are normal because of change in torsion and all. Sometimes patient can have real problems and optic neuritis, and this highlights another thing. Second thing which we want to highlight, when we are giving steroid, IOP should be measured, monitored.
Dr. Anupam, there's one question. Do you think, did you investigate her for viral illness or not?
Everything.
Viral illness, like pre-existing little sinusitis or...
Nothing was available, everything was done, and the proper workup was done, and then treatment was given under supervision of pediatric
And one of the common etiology is idiopathic also.
Yeah.
So, means...
It was
yeah.
idiopathic bilateral optic neuritis according to the investigation, but it happens just immediately after GAN, and we got the link in literature as well that propofol has led to this kind of incidents. But otherwise, after squint surgery, we have not witnessed, and we cannot. Idiopathic में recurrence का भी है ना अभी
that's what means there is a strong association after strabismus surgery or something like that.
Strabismus surgery was absolutely fine. Most probably, if otherwise it happened because of GA and anesthetic agent, propofol most.
Any other drugs causing an AIOCMT3?
No idea, sir. Thank you.
Documentous changes. Did it recover?
Yes, sir, she has recovered fully, but the this changes still she is having 0.7, 0.6 and 0.7 cup. It has reduced by 1, but this changes is persisting. Increased cup this ratio is still persisting.
And what about the fields?
Fields could not be done because of the data parameters. She is 15, 16-year-old. So we could not do that. Otherwise, visuality, color vision, contrast sensitivity, everything is normal.
Yeah, but there's one question that pre-existing, what was the status of optic disc
the pre-operative ma'am photograph has normal tha bilkul.
Absolutely normal, and
Yeah,
it went to 0.6, 0.7 in a short time.
Yes, because of after having
Even,
steroid treatment only. We have pre-operative photographs. I have shown in first line. Absolutely 0.223 cup. RNFL, ma'am, we don't have parameters pediatric, no, so we could not do RNFL.
So total progress was in how much time? Means this
She
cupping.
recovered within 8 to 10 weeks. But we were worried for the glaucoma, and when they pediatric neurologists recommend slow tapering of oral steroid to prevent recurrence in pediatric age 2. So slow tapering led to the glaucoma, and in that we were more worried for the glaucoma part, because every time her IOP was very raised, so we had to give acetazolamide and maximum glaucoma therapy it required to recover. But this ratio is still.
Any family history?
No family history, sir. We have worked up properly. Thank you, sir.